How did you find out your HIV status?
I found out in late summer of 2006. I'd actually been sick and was having breathing problems. I just thought I had an upper respiratory issue, and at the time I didn't have insurance, so I had to put it off really bad. Put it off for a while, and it had gotten really bad. So finally went to the doctor, and from the doctor's office they saw that I had no oxygen in me and that my temperature was, I had a constant high temperature. So he immediately sent me to the hospital. There I was diagnosed with pneumonia, severe pneumonia, and during that, over the next couple of days, I was in intensive care, was when I was finally diagnosed. So it was probably about 4 days, I was probably at the hospital 4 days before the test results came back final. The doctors had a good suspicion that it was, and they had prepared me. But, you know, that's when I first found out. It was pretty much, and at that point it was advanced HIV, and basically I was in the final stages. My body was in the process of shutting down. I had put it off, and went to the doctor so long. They said if I would have waited a couple more days, I would for sure have been dead. So I had really put off because of no insurance. So I ended up spending 10 days in intensive care. So that's when I was first diagnosed and found out about my HIV status.
What was your reaction when you were told you were positive?
I was scared. I wasn't as scared probably as I should have been in the condition I was. Looking back, at the time I didn't realize how sick I was. So I was, I think, numb, shocked for the first while. Like, while I was in the hospital, I was just focusing on how to get out of the hospital. I was also worrying about how to break it to family and friends, which honestly most of them had the suspicion already from me being in the hospital. And look at me, because I had dropped, during the time I was sick before I got in the hospital, I dropped about 60 pounds. So I was very thin. I was starting to develop lesions on my skin. So most people had a suspicion, but I wasn't ready to say it out loud. I wasn't scared for my life, because I had just recently helped a friend who was diagnosed, and I had gone to the doctors with him and helped him get settled and get on medications and take care of himself. So I wasn't as scared for my health. I was more, I think, scared of reaction of people.
Do you currently take medications? And if so, what is that like?
I do. I take 3 medications. So I take about 4 pills a day, only once a day. I take them at night before I go to bed. What I found, there are some side effects. For me, one of them, I'm not sure which one of the 4, kind of makes me dizzy a little bit. So I have found if I just take them before I go to bed, then I have no side effects. Like, I don't notice anything. But like, if I've missed that night and I take them in the morning, I do notice, like that day, I'm kind of dizzy. One of them makes me a little dizzy. But as long as I take them at night, it also, it gives me some stomach issues, but honestly, I just take some fiber pills and that, take that with my meds and a multivitamin, and I've found with all that, you know, the side effects are not, I don't really have it anymore that I notice.
Okay. Have you disclosed to your friends or family?
I have. Everybody, basically anybody that knows me knows. I try to be open. I'm not as open at work. There are some people at work, wherever I work, I make sure there's a few people know, just in case something happens and I get seriously injured and bleeding everywhere. So there are a few people who know. I'm not scared of them finding out. It just, right now, I just don't think it's a big issue. But all my family and friends know. My families took it better than I thought. Actually, they asked me after I got out of the hospital, my mom asked if I was. Because she had watched somebody in the early 80s, a good friend of hers at their church, who passed away. So they had seen what it looked like, and so my mom asked, and I was up front and told them yes. She was prepared for me to die. It was nice, she was, and they ended up telling my whole family on my dad's side. Just because they had good heart, they thought I was dying, and I did look like I was dying, I have to admit. So they, wanted to prepare the family for my death, basically, and my mom was preparing my room for me to come home to die, because their only experience with people with HIV was that. And then when I finally told her, I'm not planning on dying anytime soon, we had a big family meeting, my mom, dad, and my brother. He had 2 younger kids, and he, obviously was concerned, so he had talked to his pediatrician. And the pediatrician basically told him there's nothing need to worry about me around the kids. So that, it was good for my family, actually, because for the first time we talked. My family is a good Southern family that doesn't talk about anything, so this forced us to come together and talk about it. They are very supportive, which is surprising. I did not expect that, especially from my father, but he has been extremely supportive. And everybody I've told has been supportive. All my aunts and uncles on my father's side knows. All of my friends know. And at the time, I was working at this bar, and so basically all the patrons there knew, and they were very supportive during the times where I couldn't work when I first got out of the hospital. They gave me money to support, to pay rent and things like that. So far, I haven't had a bad experience with it yet. I expect it to come. I guess the one bad is dating. It does make dating harder when you disclose that. Some people are okay. A lot of people are not. That has probably been my biggest negative of being HIV positive is, dating somebody, and then when it comes to time to disclosing that and the rejection, it does hurt. And luckily, I've met some great people who haven't. And I've met quite a few that have, so it's kind of a toss-up game.
How has HIV affected your life?
Honestly, day-to-day life, it hasn't affected me at all. The only time I really think about is at night when I have to take my meds. That is the only, because honestly, since I've been out of the hospital, I haven't been sick. I haven't, knock on wood, I haven't had a cold, I don't do flu, I haven't had a flu. I don't ever see a doctor other than my HIV doctor, and that's to get blood work. So in the long run, my day-to-day life, it hasn't affected me. I have to think about the future, and it does affect jobs and careers because I really need to maintain. Insurance is really hard. Unfortunately, the way everything's laid out right now, if you don't have insurance, it's really hard to get the meds because they are so expensive. So, and there was a time where I went off meds for about a year because it was pay for my copay on my meds or pay rent. It was one or the other. I couldn't do both. So, I have to, in that way it does affect me. I have to think about how, because I cannot go off medication. I have to maintain medication at all times. As sick as I was first, when I first got diagnosed, there's, some people can go off of meds for a little while and they're fine. I cannot. I always have to be on medication. And as long as I'm on medication, I'm fine. My counts are non-detectable. My CD load is getting higher and higher. So as long as I react well with the meds, and the meds don't bother me, but the biggest issue is, my biggest concern in life is not dying or anything like that. It's how do I afford medication.
Why is testing important?
Testing important is for a lot of reasons. Just to know so you're not spreading it. Another is to know so that you can get the medication so your health doesn't have to run down. You don't have to die from it, Because unfortunately I lost a family member who put off getting tested, and by the time he found out, he was basically like me, but was a little bit more severe, and passed away with HIV-related, AIDS-related complications. And, in knowing your status and getting on medication, that helps decrease spreading it as well. I think if more people were tested, if more people knew that they were too, maybe the stigmatism would go down of it. If more people were upfront about it and actually knew, and talked about it, this image, this frightful thing that everybody has about it would hopefully diminish over time.
What advice might you give someone thinking about getting tested?
I would say it's scary, extremely scary, but it's very worthwhile. For your health, for if you're in a relationship, for that other person's health, think about it that way. I mean, if you're using protection, that's fine. If you're not, then you need to know. I admit it's a scary thing, but also HIV is not a death sentence anymore like it was. It is a very manageable disease. Like I said, I pop 4 pills at night before I go to bed. That's all I have to do, and I'm fine. I live a healthy life. It's a lot more manageable than a lot of diseases. I look at other people, like with diabetes and things like that, who are always struggling. So, even though it's scary, I think you need to know. If not for yourself, or if you're in a relationship, so you can take care of yourself, is the big reason, is doing it. There's a lot of support out there if look where to look and things like that. So, it's scary, but do it.
Why is Catawba Care important to you and the community?
Catawba Care is important for me. For one thing, like I said, I went that year without medication earlier, and that was due to the state I was living in had no support for people living with HIV. I had insurance, so they're like, you've got insurance, we can't help you. They were saying, if you go off, and this is, if you go off your insurance, we can help you, but until you make too much money, and I wasn't making a lot, and you have insurance, so you can't get help. And I had come across that with a number of organizations that had promised to help and hadn't. So at that point, at the end of that year, my counts were getting higher. I had managed to get to at least one doctor's appointment, and my counts were getting higher. So I knew I didn't have long before my health really started deteriorating. And I decided I would move back home with my parents, because I was like, well, maybe I can work and afford meds if I live with my parents. I had written off all HIV organizations, honestly, because they had not helped. I had gone to a couple in other states, in another state, and in 2 different cities, and actually 3, and none of them were any help. So I can't, when I was moving back to this area, I just went online just to see. I was like, well, let's see. And honestly, I just thought maybe I would just come home to die. I didn't know what I was, at this point, I didn't know what else to do. I tried organizations that were supposed to help me get my medications, and nobody was helping. So I just didn't know what to do. So I went online, and somehow I came across Catawba Care, and I was like, well, we'll try it one last time. And so I made a call, and I was like, this is a different state, maybe, but I figured this is South Carolina, so probably not. Because being as conservative as South Carolina is, I thought there's no way that South Carolina would do anything to help HIV people. And I talked to a case manager, Christine, here at Catawba Care, and told her my situation, and she's like, well, when you move, call me, we'll get you some medication. It was like, not like we'll try or we'll see what we can do. It was, we'll get it. And so as soon as I moved down here, I called her and we set up an appointment. And within probably, I think it was a month or so, by the time the paperwork all cleared, I had medication, which was surprising to me. I was very shocked. And, you know, in this, dealing with the staff in general, everybody was very friendly. They were very upfront. And they, I mean, what my experience is now when I come here, everybody generally cares. Most people know my name, call me by my name. I'm not just one of many, which is, you know, surprising. And they do what they say. You know, they were like, we'll figure out your meds. You know, during one point, I had left one job and was starting another, didn't have insurance. And, you know, and that was a concern. It's a concern for me all the time. They're like, don't worry, we'll figure something out. Luckily, I got insurance before, with the new job, before I needed to worry about it. But, you know, they've walked me through all the steps, and, you know, I don't feel like I'm really alone. And I'm not just filling out paperwork and then I hear from them a month later, you know, which had happened in other organizations where I spent 2 hours filling out a big stack of paper, and I got one call maybe a month later and another call a month after that, after I'd called them, and then never heard back. You know, and here I hear back, I get calls, you know, reminders of doctor's appointments, things like that, and just a friendly atmosphere here at Catawba Care. I mean, for me, it saved my life, because if it wouldn't have worked out here, I don't know where I would be. You know, I doubt, I mean, I know my health would be way down. I wouldn't be non-detectable like I have been for about a year now. And my counts wouldn't be, you know, my CD4 wouldn't be going up. You know, so I really, you know, for me, it saved my life, Catawba Care, and that's why it's important. And I think it's important for the community. In the South, it's growing, and people, this is a disease people don't like to talk about. Especially the conservative people, they don't, you know, I love my parents and they're supportive, but they don't even want their friends to know. They're ashamed of letting friends know. They support me, but they don't like it, you know, because I'm their son. You know, but this is a disease that affects a lot of people. And, you know, and in the South, it's growing because people don't want to talk about it. So I think it's important having an organization like this out there, spreading the word that, you know, we have to talk about it. You know, I know in the South we don't like to talk about things that aren't, you know, nice and sunshiny and all that, but we've got to talk about it because it's killing people, and it shouldn't be. It's a very manageable disease, but the shame and all that, people don't want to talk about it. I mean, I lost a family member because of that. He was ashamed. He didn't want his family to know because they were, you know, good Southern conservative family, and he didn't want to tell them. You know, and he died for no reason. He should have survived. So I think organizations like Catawba Care play a beneficial role. And the fact that Catawba Care is out there fighting and caring and really, you know, trying hard, and is a good organization that, you know, is trying to get the word out there. And it's a well-run organization. It's not crazy like some of these other ones that I've been to. It's a, you know, well-run organization that is trying to do the best it can fighting this disease.